Hi, my name is Leanne Jalan. I'm the director of San Juan Basin Public Health, and we're the local public health for La Plata and Archuleta counties. As all of us know, we are fighting a global pandemic with COVID-19 here in La Plata County, in Archuleta County, and everywhere in the U.S. And around the world right now. So we are working really hard as a local public health agency. Just like local public health agencies, there's over 2,000 local public health agencies around the country, and we're all learning together what the best things we can do to protect our individual communities, and then obviously work with our state and federal partners to bring the best measures that we can to keep our communities healthy and safe. So what we're doing today here at the fairgrounds, and I know that folks would like to see what's going on here. So what we're doing today here at the fairgrounds is we're doing a limited test run of COVID-19 diagnostic testing. And we are starting with the specimen collection here at the fairgrounds. You'll see that there's lots of folks out there set up to do a drive-through. There are protective measures in place for the people working it and for our law enforcement partners that are helping us with it. So everybody outside is dressed in personal protective equipment. So as soon as you guys go outside, we'll walk you through how to get through that so you can see what's going on. But basically, the difficulty that we're having with the COVID-19 pandemic in the U.S. is that we really lack ability to have enough diagnostic testing to find out what the scope of infection is and what the scope of community transmission is in our communities. So for public health to fight any communicable disease, and in this case the communicable disease that we're fighting is truly a global pandemic, we have to have diagnostic testing so we can direct our public health measures that contain disease. So the way that public health contains disease is we run diagnostic testing, and then we put in measures like quarantine, isolation, and further monitoring so we can contain or stop the spread of an infection. With COVID-19, we don't have the testing and we don't have the ability at this time to stop the spread. So the next step is to slow the spread. And we've talked a lot about that in national media and statewide and local media, that slowing the spread is how we protect our health care from getting overwhelmed with rates of infection. So the ability to do widespread community testing either gives us the option to put in containment measures, which are quarantine, isolation, and monitoring, or it gives us the ability to direct our community mitigation the best way that we can to slow the spread of infection. And community mitigation is the things that we're all struggling with right now. So this is probably the first time that you have been at a media event where we've asked everyone to stand 6 feet away from each other. We are all working from home as much as we can. We didn't greet each other by shaking hands. Nobody that knew each other gave anyone a hug. We're working really hard to wash our hands, not touch our faces, do everything we can to slow the spread of infection. We still need more testing to direct those efforts. We have not been able to get testing solved in this community or any community because there are multiple steps to solving testing. We need more test kits available. We need more access to testing in local communities, but we also need to work through the backlog at labs so that we can process all of the tests. So with these kind of hurdles in front of us, San Juan Basin Public Health was able to bring in 100 tests to do a really limited test run for our most high-risk populations so that we could get an initial snapshot of where we are in this community with COVID-19 so we could best direct our efforts to slow the spread of infection. So that's what we're doing here today. And it is a very limited initial test run. We are working as hard as we can on local, state, and federal levels to have wider available test runs. But right now, what we're doing today is the first 100 we were able to bring to the community. It is limited to healthcare workers, first responders, individuals who are over 60 years old, and individuals with specific chronic conditions and symptoms. So if you are in any of those 4 categories, and I'll say them again, healthcare worker, first responder, over 60 years old, or have specific chronic conditions, and you have symptoms, you can get in touch with your primary care provider, get a doctor's note, and come in here today to get one of the first tests that we've been able to make available to this community. And again, this will give us the first snapshot of where we are with infection rates in the Durango area and La Plata County. Thank you. And I think with that, that's kind of my introduction, and I have, do folks have any questions about our test site today? And we also have Sammy Stevens, our epidemiologist, here if we would like questions for our epidemiologist, but we'll switch out maintaining a 4-foot distance. Yes?
6 foot off.
6 foot. Did I say the wrong number? Sorry.
So if all things go well, how long can we expect to have widespread coronavirus testing, assuming things go well and we can get access to them?
So
if everything goes well and we don't have some sort of weird something pop up,
right.
When can we expect community testing to be available?
Oh, that's a great question. We're all really looking forward to the answer to that question. There are, I think what we know is there are multiple things to solve before widespread community testing is available in every community in the U.S. because it's not just, there are kind of supply chain issues with personal protective equipment. There are supply chain issues with the actual tools that we need to collect specimens, which are swabs and viral medium. And then there are issues with our lab processing. So each one of those things, I'm 100% sure there are folks that are tirelessly working to get those solved. But to give you a prediction that we know this is going to be solved by, next week would be not a fair thing to say because there's multiple problems. So we're with you on wanting the answer to that question. Thank you.
How long does it take to get the results back?
So because our results are all processed in Denver, and the difficulty here is that we obviously have to get them sent to Denver by courier. So that already takes 1 day out of the process, and then it's about a 24-hour turnaround at the state lab. But because we know we have lab processing delays, we don't know exactly when we will have our results back. We're looking, our best guess is 5 to 7 days. We're hoping to be better than our best guess on that. And the other thing is, because we have a very stringent population that is accepted for tests here, we expect that our tests will all make it through the lab to the head of the line, whereas if we open this up for wider community populations, those tests would either be at the back of the line or not processed in Denver. So we are doing the best we can to get the right population tested here so that the tests can get to the front of the line.
I don't know if you can answer. I heard that Mercy had a confirmed case last night.
Okay. We do not have lab confirmation on any residents in La Plata County, nor do we have lab confirmation for any employees in La Plata County that live in other that live in other communities or other states.
Okay. All right. And
now, with that, I do want to be clear that we know testing is limited. So while we can also say we do not have confirmation, we are operating under the assumption that after we do this testing event, we're going to get a whole lot better idea, and we're going to find out that we do have positives in our community. So it's a tricky message because both things are true.
Spoke with a Mercy employee who told me they're directed to only stay home only if they're symptomatic, not if they've been exposed, compromised. Can you comment on that?
I think we'll have that. We'll direct that to our epidemiologist. There are very specific rules for quarantine and isolation,
okay.
And we can give you what the CDC recommendations are.
Okay.
And I cannot speak to other employers' instructions. Right? We follow the CDC
okay.
recommendations, and we'll be happy to go through those.
Okay. So they have to meet these 4 criteria.
Mm-hmm.
They have to be symptomatic.
Correct.
And they have to have a doctor's order.
Correct.
Okay.
But we're making the doctor's order as simple as possible.
Okay.
It's mostly call your primary care provider. They can send you the order to your smartphone, and you can show it at the first entrance to the testing site. people can leave a note outside their practice for someone to come pick it up at their practice. We are trying to make that an extraordinarily easy step because we are trying to get the right population in here. But with that, we also wanted to make sure that our provider community was very engaged in this process and working together with us to slow the spread of this together.
So can you tell us how you worked with the community to get the word out that this was happening?
Yeah, we stood up our Department Operations Center, San Juan Basin Public Health did about 3 weeks ago, and at that time we started multi-agency coordination calls, and on those calls, which are 3 times weekly, we have all of our government partners, we have our law enforcement partners, our emergency medical transport, our schools, just anyone who's affected by this. And with that, we also had providers invited, healthcare and providers invited to these calls, and then we spun off a healthcare provider group that also meets separately weekly to kind of get updates as to what we're doing. And we worked with that provider group. We worked with that provider group earlier this week and then a second time this week to say we will be working really hard to get these tests in. We're bringing the resources in. Can you start helping us get the right patients to our first test run? So,
can you tell us how many people you've seen so far today?
We were taking about 10 or 12 an hour, and we think we've had steady. I have not been outside because I'm not dressed in PPE, okay. But we've had for 2 hours. We've had over 20 people come in our first 2 hours.
And it's through tomorrow?
Yes. Okay. It's so what we expect is we'll do it for about 6 hours today. Our hours were noon to 6, and then we think we'll be open 9 to 12 tomorrow. Okay. If we run out of test kits before noon, we'll have to close early. If we go past, if we still have 5 or 6 test kits left at noon, we're not going to close up. We were able to get 100 test kits into this community. Yeah. We want to use all of them, yeah. And we want to use them on the right population that's actually going to make it through lab processing in Denver.
What about, could you tell us about the PPE? And I don't know if that's for her or for you, but.
Can you take that when we switch out? Sounds
just
like okay.
What you guys are doing out there,
okay.
What kind of precautions the staff is,
Yeah, we can walk you through that.
Okay.
Yeah, and then you guys will see it on your way out. But it is Droplet Precautions, okay. Which we can describe in a little bit more detail. But it's gowns, gloves, face masks, goggles, and 95 masks.
Okay.
That makes me think it's not Droplet Precautions.
It's Droplet and contact and goggles. Yeah.
And okay. We'll have our epidemiologist give us a better answer to that.
So, what does the best case scenario look like for our community?
Well, I think our community is doing super well at voluntary compliance with something that's really difficult. So best case scenario is we all get better at the awkwardness of greeting people from 4 feet away, and that as many of us as possible who are able to work at home. We know that our schools are closed for a period of time. We're, stepping up our hand washing. I'm trying to think what other kinds of. We've closed. It was just super unfortunate, but we've asked our restaurants and bars to only serve to-go food. We are asking people to not gather in groups of more than 10 people. And from what we can see, we get it here, and people are trying really hard to comply with all of these things. So this is what's super tricky about this. If we comply with all of that, it doesn't mean that the infection is going to go away. It means that we're slowing the spread, and it means we're doing this for quite some time. So if this thing comes and goes really quickly, that's actually worse because it means we spread a bunch of infection really fast and we got our healthcare system overwhelmed, and we will have more fatalities than we should have. So when we ask the question, how long are we going to be at this? Unfortunately, the answer is the better we do with this, the longer we're going to be at it, and we're looking at something that we're not measuring in weeks. And I hate to be the bearer of bad news, but the longer we do this, the more lives we save.
Yeah.
It's not fun for anybody.
I was curious about, is there, obviously in addition to just the, precautions, we're asking everybody to wash their hands, stay 6 feet away, no contact, self-isolate, quarantine, those kinds of things. Are there other things the community can do to help? So for example, I saw CDC says it's safe to give blood. Is that a need in our community that we want to ask people for,
I think that would be great. They absolutely follow all of the appropriate precautions at our blood donor places in town, and we're expecting a run on healthcare, and we're expecting that certain things that people normally do in the background. We have heroes in this community who normally do things like give blood on a regular basis, and what healthcare is afraid of is people are going to stop doing that, and we can assure you that they have appropriate precautions in place. So if that is something that you can do to help with this, please do it. That's the right thing to do.
Are there other things that people can do in the community?
It's a great question. I don't have a great answer to it. I think it's really, it's kind of pulling together as a community and, helping each other out with our new normal. It's, it's going to be stressful. We're learning to work at home when your other family members are homeschooling and home working, and none of our houses are big enough for this. I saw a cartoon this weekend which was mapped for my weekend plans, and it was, bedroom to living room to kitchen. And normally, especially around here, people are used to getting out and doing a lot of stuff. So it's a really tough adjustment. And I think it's really just giving each other grace, being kind to each other, and recognizing that we're all doing something really hard together. No one expected to be home 24 hours a day with all of these people that you love, but you're used to seeing, in the mornings and after work. So some of it is just being kind and giving grace to each other.
I don't know if you can speak to this or not, but could we anticipate a shelter in place like San Miguel County has put it in and California?
Yeah, I think it's more important to look at the shelter in place language and shift it to a stay at home language, right? Because, I almost touched my face. Okay. So when we say shelter in place, because we're really addressing this from an emergency management perspective, because we are emergency managers, shelter in place is a term that we use, and it carries some tremendous weight. And when we shelter in place, we think of that as something that, we're going to measure probably in days, not weeks or months, right? So what I would prefer is we shift the language to the stay at home language. And if we are really good at staying at home, and we can really do the best we can to slow the spread of this, we may not have to go to shelter in place, because it's not that different. The most important thing is, if it's not essential, don't do it. Stay home and get it done, another time.
I just question this, bullet. Don't shake hands or hug, instead bump fists or elbows. Is that really okay for
No.
people to be
No,
doing
I
that?
think that some of that was written before we got
Okay.
into the next phase of this.
Okay.
So we're actually bumping elbows like this now from so I think 4 feet from elbow to elbow, 6 feet from human to human, but 4 feet elbow to elbow. So yeah, our fist bumps and our elbow bumps are not, we're not making human to human contact.
Yeah, so it's really don't shake. We made some, actually Fast Signs made some stickers that said no hugs, no handshakes, just smiles.
Okay.
Right? So
And-
I don't know, I'm just curious because I'm seeing it places and it just seems like,
How about
we
like,
shouldn't be touching
like,
at all, right?
yeah, it's a, what's the word, a virtual fist bump.
Okay.
Yes.
All right.
So I apologize for that. Yes,
okay,
we're
I'm
moving.
just curious.
The other thing is we're moving really fast,
Yes.
and the guidance changes frequently. So we can all agree that we'll fist bump like this or elbow bump like, but not actually touch.
Okay.
Sorry.
That's okay. No, I'm just was curious.
I appreciate the question, and thanks for giving us a chance to clear it up.
Yeah.
I have a question.
Yes.
So based on the test results you're going to get back from this weekend,
Yes.
do you foresee more changes happening once those come back? Like what kind of things are we looking at?
And I think that's the similar type of question is, are we moving into, shelter in place or stay at home orders that are more widespread? And there's a couple of things at play. It's what do we find out our community transmission burden is, but it also is how successful are we right now with the compliance that we have, right? There's not a tremendous difference from where we are right now to what that would look like, right? It's basically, we, as of the last couple of days, we've asked restaurants to not serve people, we've asked people not to gather in groups of more than 10, we've asked other non-essential businesses, nail salons, hair salons, massage parlors, all of that to close. We've essentially limited significantly our tourism business by closing our ski areas, which means that our hotels are not getting used. We don't have the tourists coming into town. So all of that is already happening. So to say, well, what are we going to do next with the data we get from this? It's a little bit like we're learning every day new things about this, because there is not really a perfect guide for what we do next when we're dealing with a novel virus. So what I want to stress is we're doing it, right? We are staying home if it's not essential, and that's the right step for everybody right now.
Would the results, possibly based on the results that you get, possibly allow you to get more kits or funding? Like, what could it possibly lead to in terms of?
Yeah, because there's a shortage on, getting laboratory results. There's a shortage on specimen collection. There's a shortage on processing. There's a shortage of PPE. If we have a better snapshot as to what's going on here, it will shift our ability to bring in the next set of resources depending on where we are. So that is absolutely an important piece of this.
Now with Colorado, I was looking at the map.
Mhm.
It's one of the higher, numbers states. Talked with a medical person this morning who said, yeah, but we're not growing as fast, or it's not reproducing. I didn't have the exact detail, but I was curious. Do we have that kind of information about Colorado, really?
It's funny because we're so hungry for information that we're all looking at the numbers. Everyone's getting updates on their phone all the time of how many positives. I remember a couple of nights ago we were home with CNN on the background, and the number just kept going up, from one show after another. It was, so what we know from the numbers are the number of positives are increasing. We also know that we've had, increased fatalities. So, but what we don't know is, I don't think it's fair to compare from community to community or state to state when we know everyone is limited in their ability to test. That's why we're putting in the community mitigation measures that we're putting in right now. I think it's a totally reasonable question. We're all staring at the numbers, and, I would just caution, let's not get hung up on the numbers just yet. These are great questions. Thank you. Yes?
Are there other health concerns with quarantine? For example, lack of medication. The grocery store shelves are pretty dry right now. Is there a public health concern based on that kind of stuff?
Well, so when we talk about whether we are at the community mitigation measures we're at now, or potentially increased ones, the essential services are things that we would never cut off. And part of the reason that we move very, as quickly as we can to respond to the crisis, but also as slowly as we can to think of everything. So there's a whole lot of conversation going on about how do you make sure that essential services are up and running when you ask people to stay home. So we are not expecting to see issues with people, getting food. We're not expecting to see issues with folks getting their prescriptions filled at the pharmacy. We are asking, if you're a vulnerable population, think about getting your prescriptions filled other ways. If you can do mail order rather than go to the pharmacy, that's a great idea. But we're never going to say you can't go to the pharmacy to get something fulfilled, because that would just create a whole different set of crises, right? And this is something that we saw in our schools, really thinking hard about, well, what's the right decision to make for a school? Well, by the time that the school was well positioned to make that decision, it's because they had thought through, how are we going to make sure all of these kids get meals? How are we going to make sure that everyone has learning materials to get home? So, I just want to be really clear with everyone, these are really hard decisions, and people are working as fast as they can to invent new things. Like, when did a school district say, oh my gosh, I'm going to feed all of my kids, breakfast and lunch, because they weren't expecting school to be closed, right? And maybe we've thought about that before, and maybe we even have a plan on a shelf for that, but when we pull that plan off a shelf and open it, there's a lot of head scratching of like, okay, how are we going to do this? So we're on the exact same page. We have to keep essential services open, and essential services are food and medicine and other things we rely on for, activities of daily life.
I know we've already reduced our public transportation with the T, the bus and the trolley and things like that, but could you see, foresee us needing to cancel flights?
I think some of that's really unknown as to how this is all going to, where this is going to go. Everything is on the table. The conversations that we're having with other governments and having, with state agencies is we recognize everything's on the table. There's no planning yet for those types of measures. Individual communities have made adjustments in their public transportation. And with that, we also need to have people be able to get to the supermarket, to get medicine, that kind of thing. So they're tough calls, and I don't know what's going to happen for that.
Could you talk about how you're working with other communities? So for example, Montezuma or other hospital systems, are you all working in a coordinated effort or?
Yes, there is a tremendous amount of coordination going on between state agencies. So there's 53 local public healths in the state of Colorado serving 64 counties. We're in daily communication with each other. We all interface with the state agencies, and we do that through a coordinated effort. And then here locally, we coordinate all of the agencies that are touched by this in a multi-agency coordination fashion. So our team is running around kind of all participating in different coordination efforts and then trying to get all that information back to each other so we can put puzzle pieces together and make decisions for this community. And the other thing that's been really tremendous is, San Juan Basin Public Health serves 2 counties and 4 municipalities. We're also in really close contact with the leadership in both counties and all 4 municipalities to make sure that we're giving a very coordinated effort here, because we know that our constituents, travel from one county to the other, or they travel from one municipality to, so there's a lot of, it's a lot of coordination to keep up with. Do we want to do we want any epi questions, or do you guys feel, or do you want to get outside and get to see?
Maybe just could talk about maybe you covered it, just what's the kind of protective gear that people are wearing outside. It might be interesting for folks to know, but maybe we got it. Droplet precaution
And contact precautions.
And eye protection.
Eye protection.
Droplet precautions, contact precautions, and eye protection. Well, we appreciate folks coming out to get some answers to some hard questions, and we all want to keep people safe and healthy together. Thank you.
Thank you.
And now Claire will give you instructions on how you get out to the testing site.